Good evening, everyone.
Good
I
evening,
hope.
sir.
Good evening, sir.
Okay, so we'll be starting in a while. So I ask everyone, please, you can mute your mic so that there won't be any disturbance in the presentation. That's a request. Thank you. Okay, so good evening, everyone. And thank you so much for so overwhelming reply and participation for my webinar. Actually, I've anticipated less, but seeing your response, I was really happy. Okay, so we'll start our presentation in a minute or so. I'm still waiting. Participants are still coming in. So just wait for 1 or 2 minutes more and then I'll start. Yeah, so for smooth transmission, I will be switching off my video as well. So there won't be any interruption from my side. Okay. And if you feel any difficulty or problem in between, you can just put it in the chat box. Okay, so we'll start now. Thank you again, and good evening, all of you, my colleagues, friends, and I can see a lot of my students who have joined in. So now, as you know, all of us, we are going through one very unprecedented time. Okay, so whatever we are facing, we haven't expected, have seen something like this before. But we have got a lot of time to contemplate on many things, many aspects of our life. So hopefully this time will have some positive impact on our life. And whenever we'll go back to our normal routine, I hope so very soon, we'll get along with us some positive things that we have learned in this lockdown, and we'll be able to shape our life in a well manner. So now I know all of you have attended so many webinars during this lockdown. I myself have attended too many. So, but this webinar is a bit different. It has a blend of your professional life, of your personal life as well. So I suppose this will be a little bit interesting for you to attend to this seminar, and I'll try to make it as simple and as interesting as possible from my side. I'll try to make this topic very simple and interesting to understand using all of my lexicon and my knowledge that I have gained over the period of time. So now everything, whatever I'm going to present in this webinar, it is something that I have gathered, I have learned over the period of 2 or 3 years down the line. Okay, so all the facts, they are supported by uh, government websites or government authorities. Okay, so if you have any questions, in the end I'll be having a bigger announcement for part 2. So stay tuned and do attend the seminar complete. Okay, so now, wow, so dentistry and Canada permanent residency. Okay, so what all things we can expect? Just on a second. Okay, so dentistry and permanent residency of Canada. Now, all of you, I suppose you know me, myself, Dr. Abhijit Patil. I'm a prosthodontist, I'm a Canadian PR, and I'm accredited speaker for Maharashtra State Dental Council, and I'm member of International Congress of Oral Implantologists. Okay, so before we dive into our topic, I want to conduct a small poll. So, just a second. Okay, so a small poll. I want to know why you want to move to Canada. Okay, so I'll be launching poll. You'll have 20 seconds to answer the question. So here we go. Ten more seconds. Okay. So I'll be sharing the result now. Okay, interesting. So I can see 52% of people, they're in favor of better employment and job perspective. Okay, very good. 30% expect for better quality of life. Okay, interesting. No social security and safety for family here. So you have it here, I think. Work-life balance, that is again true. And 4% they are not sure. Okay. So the thing is, there are many more reasons to move to Canada. It is very personal decision. It is very subjective thing. So I'm glad that you have shared your insight with me. Okay. Okay, now some facts about Canada. Now, Canada is the second largest country in the world by area wise. Okay, it shares largest border with America, United States of America. It has largest coastline. Plus, Canada produce over 85% of the world's maple syrup. Canada also has longest coastline, as I told you, and ice hockey was invented in Canada. If you see the map of Canada, the Atlantic side, it has a provinces called Quebec, New Brunswick, Nova Scotia, Prince Edward Island. They are mostly French speaking, French dominating area because Canada has two official languages. One is English and the another is French. As you move towards British Columbia, English becomes the most dominating language. Then Canada is really beautiful, as I've seen. And what are the places which I like the most is world famous horseshoe waterfall, commonly known as your Niagara Falls. Then you have Fairmont Resort in Banff, Alberta. Then you have beautiful Toronto skyline with CN Tower in the center, and your Canadian Parliament in the capital of Ottawa, next to your Rideau Canal. Now, many of us, we think these people are actually American, but they are Canadians. So the famous people are Elon Musk, Justin Bieber, Bryan Adams, and Keanu Reeves. They actually work in United States, but they're actually Canadians. Now, the most chilling, most intimidating thing about Canada most people think of is the Canadian winters, very notoriously famous. Either you can enjoy the Canadian winters with skiing in the very famous Rideau Canal, which just freezes in the winter, or you can just faint shoveling the snow around your house or around your parking. So choice is yours, what you are ready to do. Now coming to our dental part, very significant dental thing or related to dental profession, the significant event that ever happened in Canada is your 1982, the Toronto Osseointegration Conference, in which Dr. Zaab invited Dr. Brennemark, very impressed with his research on titanium-based implants. So he invited him for a conference where Dr. Brennemark has done a presentation for his actual research, where he coined out the term osseointegration of titanium implants. And Dr. Zaab, he saw very much big potential of those implants in rehabilitation of edentulous patient. So as you know, the titanium implant industry just boomed after that, and rest, as you all know, is the history. Now, dentistry and building your career as a dentist in Canada. Now, I'm telling you, building a dental profession, a career of a dentist in Canada, it takes a lot of hard work, patience, dedication, persistence. And what are the facts and things I'm presenting to you today? They are just to make sure that you don't hit the reality bang on. So I'm just making you aware with the situation that actually is there in Canada. So you should be well prepared to face the realities. Now, what is our today's agenda? Our today's agenda is fourfold. First, I'll talk a little bit about dentistry background, how dental practice work, and what are different dental schools in Canada. Then about the NDEB process, what are different pathways that you have to take to get NDEB certification. Then your dental programs, what are different dental programs, and get to know the standing of your dental degree, how it is compared to the dental degree in Canada. Then lastly, which is just out of the box, is your permanent residency, but it is very much in relation with your dentistry and your profession because it has huge impact on your dental profession. Okay, so coming to the first part is your dentistry background. Now, dentistry is highly regulated profession. It is like some kind of protective bubble in which the Canadians, they have kept the dentistry. You're not allowed to interfere too much, or if you have to be a PR or a citizen. It is highly regulated profession in which you have to get a licensure in order to practice dentistry or any profession related to dentistry. So the degrees that you get, or whether it is a DDS or DMD or BDS, it should be certified by National Dental Examining Board. Okay, DDS and DMDs are just 2 degrees. It depends upon university to university which degree they prefer. DDS stands for Doctor of Dental Surgery and DMD stands for Doctor of Medicine in Dentistry. Now in Canada, there is one very unique feature which is called as a NOC code. Okay, NOC stands for National Occupation Code. In Canada, they have divided various profession, all the profession in code-like manner. Okay, for each profession, they have given one code. Under that code, you'll find all the responsibilities, all the roles and responsibility of that particular profession. So it is useful for you to match your profession from outside Canada to the Canadian profession. So it becomes very beneficial for professional people to match their profession, but it is not that much of hectic for dentists, as dentists only have one NOC code, which is 3113. And whether you are a general dentist, whether you are a specialist dentist, a prosthodontist or orthodontist, you'll have only one NOC code, which is 3113. For example, there is a NOC code for university professor is 4001. Okay. So, and if you have to get admission into a dental degree or a dental program after your high school, after your 12th standard in Canada, for Canadian citizens and Canadian PR, they have to get one degree, which involves a pre-dental education for 1 year, like courses where you have biology, chemistry, or microbiology as one of the topic. If you are from outside Canada, if you are an international student, like in India, in case, we have 11th and 12th standard where we learn science, and these subjects are already included. So we can get directly admission after 12th standard. So now coming to next thing is CDAC. Now what is CDAC? CDAC is Commission on Dental Accreditation of Canada. It is a body which is responsible for accreditation of various dental and dental related professions, like your general dentist, dental specialties, denturist. Denturist is a profession in Canada where professional denturist makes dentures for a patient. Then you have dental hygienist and dental assisting. These courses, these programs, sorry, it is highly accredited and regulated by CDAC and Dental Regulatory Authority. Now CDAC works at a national level, and Dental Regulatory Authority, they work at the provincial level or the state level. So different state or provinces, they have their own dental regulatory authorities. For example, Royal College of Dental Surgeons of Ontario is for Ontario State, Alberta Dental Association and College is for Alberta State, and College of Dental Surgeon of British Columbia is for the state of Columbia, so on and so forth. Okay, so in order to get to practice in that particular province, you have to register yourself with these dental regulatory authorities so you can practice dentistry in those particular provinces or the state. States, we call it state, but in Canada, the states are called as provinces. Canada has around 10 states and 3 territories. Now, very important part, dentist wages. Wages, again, the salary that dentist earns in Canada, very important part to understand before making your move, right? So now the dentist wages, the average range has been divided into 3 parts: low, medium, and high. The lowest a dentist can earn in Canada is somewhere around 30,000 Canadian dollars. Median wage is somewhere around $118,000, and highest is somewhere around $261,000. So this is just a national average. If you see province wise or state wise, Alberta is the state where dentist earns the most. Okay, so the highest they'll get paid for is somewhere around $350,000 or $400,000. Okay, the lowest is being Nova Scotia, followed by your British Columbia, Ontario, and Quebec. So depend upon these provinces, you can decide where exactly is the scope for dental profession, and you can make your move accordingly. Now, what is the employment outlook? Now, when we talk about employment outlook, what all things we can see is how are the job prospects for particular profession. For dental profession, as a dentist, the job prospects are 5-star rated, means they're good. Okay. And some facts about dentistry, dental profession or dentists in Canada, that the average retirement age of a dentist in Canada is somewhere around 65. It is a little bit more than national average for other professions. And median age of a dental worker or a dental force is somewhere around 47 years. And total of 26,800 jobs were created in the year 2018 in Canada. Okay, now coming to a detailed analysis of this, how these things work. Now, when I talk about detailed analysis, what factors we consider? We consider the unemployment rate for dental profession. What is the unemployment rate for dentist in Canada? It stands at 0.9%. You can imagine. In India, the unemployment rate for dentists stands at 27%. So you can imagine the difference. Now, it is significant. It is less than the last year's unemployment rate, and it is significantly less than national average of Canada, which is around 5.8%. So the dentist unemployment rate in Canada is very low. Reason? That 87% of the dentists, they are self-employed. So you don't have to go anywhere else looking for a job. You can open your own clinic. That is what mostly happens everywhere in the world also. But in Canada, around 87% of dentists, they are self-employed. They have their own clinics. Initially, when you get your degree or when you get certified, you can go as a consultant dentist to other clinics. Once you are settled and everything, you can open up your own clinic. Now at current state, if you're talking about the current state, the dental profession is at balance condition. What do I mean by balance condition? Is the dental profession, dentists, they have seen for last couple of years that the work hours on which the dentist works, it is relatively stable. Okay. And there are sufficient amount of job for the dentists which are available in the market, which makes this profession is in the balance condition. So there is no shortage of the job, or there are no less dentists which are to fill those jobs. So now these information is the website is called as a Canadian Occupation Projection System. Okay, it projects and it analyzes every profession year-wise on a period of 10 years. Now, if you see the projection period of 2019 to 2028, the dental profession will face shortage. Means there will be less dentists to fill the places which will arise. Now, what are the main reasons for the job opportunities which will be created? Because of the population growth, the friendly immigration policy of Canada, then the retirement of the dentists who are working currently, and increased awareness for oral health. These factors will play a very important role in opening new job opportunities for dentists, and retirement is the main factor which will play the role. So now there will be initially a surge in the demand for dentists, okay, and it will settle down. So what will happen is there will be a total 12,200 jobs which will open up during these during this 10-year, and the number of dentists which will be available to fill this job were 7,000. So you can imagine the difference. It is around somewhere around 5,200. So 5,200 dentist position will remain vacant. Okay, so this workforce, the dental workforce, will face shortage in coming 10 years. Now this surge will then try to settle down because of basically two reasons. Now there is one interesting thing, the dental hygienist. Okay, dental hygienist in Canada, they can open their own clinic if there is regardless of dentist, if there is dentist or not. Okay, so they can work without dentist in their clinic. So that will shift the position of a dentist. Okay, also the dental insurance which will be available for retirees won't be there. Okay, so these two reasons, it will again try to decrease or try to break the surge in dental profession. Okay, now when I talk about dental profession, the places to fill the job seekers, the main job seekers come from your Canadian dental schools. Now, Canadian dental schools, they have very limited number of quota. Okay, In near future, the quota is not going to increase because their policies are not what we see in India. They have very strict regulations to increase the number of dental graduate seats in particular dental faculty. And also it takes around 4 years for a dentist to get out of the college. Okay, so dental profession will face shortage in coming 10 years. So the perspective of dentists are good in coming 10 years. So now, which are different faculties or colleges in dental related to dentistry in Canada? There are basically 10 dental colleges or universities. Okay, first is your University of Toronto Faculty of Dentistry, Dalhousie University in Nova Scotia, Halifax, University of Western Ontario is in London, then University of Manitoba, which is in Winnipeg, University of Saskatchewan, College of Dentistry in Saskatchewan, University of British Columbia, Faculty of Dentistry in Vancouver, British Columbia, University of Alberta in Edmonton, McGill University, Faculty of Dentistry in Montreal, and University of Montreal and University of Laval. University of Laval is in Quebec City. So the last two universities, University of Montreal and University of Laval, they offer dental education only, dental programs only in French language. Okay, so I won't be covering that because all other universities, they provide dental education, dental programs in English language, including the McGill University, which is in Montreal as well. The Quebec, these three universities, they are in Quebec part of Canada. Quebec is the province where French is the official language. Okay. Now coming to the second part of our agenda is NDEB process. Now, before we go to this NDEB process, I would like to conduct a small poll again. So you just have to answer yes or no. Okay. So these are the results. 71% people, they don't know about the NDEB equivalency and certification process, and 29% of people, they say they know about the equivalency and certification process. Okay, so hopefully I'll be able to provide you with some more information for those people who know about it. All right, so I'll try to do my best. Okay, so okay, so now what is NDEB? NDEB is an acronym which stands for National Dental Examining Body, Board of Canada. Okay, it is created by an act of parliament and it is dedicated to supporting the health of Canadians by maintaining the national standard for general dentistry in Canada. So it regulates, it doesn't regulate actually, but it maintains the standard practice of dentistry in Canada. Also, the NDEB develops and administers innovative, internationally recognized examination all year round. And in 1 year, they actually certify somewhere around 1,000 dentists from Canada and around the world. So they get their NDEB examination, they do their NDEB examination and get the NDEB certification in order to practice dentistry in Canada. Now, NDEB and Dental Council of New Zealand, they have mutual understanding with them, meaning if you pass NDEB examination, equivalency examination and certification, you will be able to practice dentistry in New Zealand as well. So whenever you fill up your form, they'll ask you where you are interested to practice dentistry once you finish your NDEB certification. So you have to choose between either Canada or New Zealand. Now, dental programs, there are two types of dental program. One is non-accredited dental programs and the second one is accredited dental program. We'll see both of them in detail. First is your non-accredited dental program. What do you mean by non-accredited dental program? Non-accredited dental program are those dental programs which are not accredited by CDAC. Okay, the CDAC, which is the accreditation body at the national level. So basically the degree from India and from many places, it is non-accredited dental degree. So what pathway you have to take for getting registered as a dentist in Canada? Now the structure of the certification and equivalency consists of two parts. One is NDEB equivalency process followed by NDEB certification process. Now you have to give total 3 exams, which are called as assessment of fundamental knowledge, assessment of clinical judgment, and assessment of clinical skills. These 3 exams, they make an NDEB equivalency process. Okay. So once you pass your assessment of fundamental knowledge, which is called as AFK, you can appear for assessment of clinical skills and assessment of clinical judgment simultaneously. Okay, but I'll advise you to give 1 exam at a time. Okay, so these 3 exams will make NDEB equivalency process, and once you're done with your NDEB equivalency process, you'll give written examination and OSCE examination, which is called as NDEB certification process. Okay, so now the graduates of non-accredited dental programs, they have to go through NDEB equivalency process, meaning they have to give these 3 exams followed by NDEB certification process, which is written and OSCE. Whereas the graduates of accredited dental programs, they just have to give written and OSCE, which is NDEB certification process. That's the basic difference. So now NDEB certification process, again, for non-accredited dental graduates, there are 2 pathways. One is NDEB equivalency process. You complete NDEB equivalency process and get NDEB certification, get admission for NDEB certification exam, or you can complete a degree completion program and go for NDEB certification process. So these 2 programs or processes are very important. So please pay attention to the process that I'm about to tell you. Now coming to NDEB equivalency process. Now NDEB equivalency process is strictly for those graduates, dental graduates, who have whose degree is not accredited by CDAC. Okay, so a dental degree from India is non-accredited dental degree. Okay, so what is the flow for this process is, first you have to do your application and credential evaluation. Your application is approved, then you can register yourself for AFK, which stands for Assessment of Fundamental Knowledge. Once you pass AFK, you'll be able to register yourself for Assessment of Clinical Judgment, followed by Assessment of Clinical Skills. Once you pass those 2 exams, you will be transferred to NDEB certification process. Now, as I told you before, NDEB certification process consists of written exam and the OSCE exam. Okay, when you pass those 2 exams, you will be awarded with, you'll get NDEB certification, and after that you can register yourself with a particular provincial dental regulatory authority wherever you want to practice dentistry. Okay, then coming to each and every step in detail, first is your application. So how to prepare your application? Okay, this is very important part. You have how to prepare and what details you need to understand while preparing your application. Now, first step is creation of online profile. Okay, you have to go to NDEB website. Okay, in that you have to go under non-accredited dental program and you have to register yourself. You have to create a profile. To create a profile, you need a soft copy of a photograph in JPEG or PNG format and a valid credit card to do a one-time non-refundable payment of $900 Canadian dollars. Okay, so once you do that, you'll get your profile. Okay, you'll get your profile number, your reference number. Okay, so once you get your profile done, you have to submit 2 sets of documents. Okay, one set of document will be submitted by you and one set of document will be submitted directly by university, by your university from where you have done your BDS. Okay, so it is not like that you'll get the documents and you have to courier it. It is strictly by university, otherwise they'll reject it. Okay, so what documents you have to send? You have to send a notarized copy of your passport, then a name change notarized copy. This is in case of ladies who's like after marriage their name changes often. So if the name on the degree is different than your current name, so then you need a name change notarized copy. Then you have to send your original BDS degree, your degree certificate, which you have got from university, and you have to send your original internship completion certificate. So you don't have to worry about it. You'll get it back. So don't worry. The NDEB after assessment, it will send it back to you to your address. Okay, so this is what you have to send as a candidate, and what you have to ask your university to send is a confirmation of degree form. This form, once you create your profile, you'll be able to download it. You'll get a mail of this form. So in that form, there are two parts, part A and part B. Okay, part A you have to fill, part B university office has to fill. So now from which university office, this is again very important. You have to get it filled from registrar's office or controller of examination office. Okay, either of them. So they'll stamp, they'll enter your details and everything. They'll attach your official transcript with sign and stamp of either registrar or controller of examination. Okay, so once these documents are sent to NDEB, the NDEB headquarters in Ottawa, they will assess and they will do the verification of your credential. So once the verification is done, the documents and everything, your profile is active and you can register yourself for AFK examination. Okay, now coming to the AFK examination, actually, what is AFK? AFK is assessment of fundamental knowledge. Now this examination, it assesses your very basic, very fundamental and the depth of your knowledge, basic knowledge. Okay, so you have to be thorough with each and every subject that you have studied in your dentistry, in your BDS, starting from first year to fourth year. Okay, so what's the format of this exam? It consists of 2 sessions in one day. Okay, 2 sessions of 3 hours. In between those 2 sessions, you will get a break of 1 hour for lunch or etc. etc. And in each session, you'll have 150 questions. Okay, so you have to answer those 150 questions. So total, you'll be answering 300 questions in 2 sessions. Okay, now how you score, how you, if you get to know that you're pass or you're fail. Now the scoring criteria is consist of 75 marks. Okay, so if you get 75 or above 75, it is considered as pass. Okay, now very interesting things about these NDEB equivalency exam is for passing standard, they have something called as a test equating procedure. So what is test equating procedure? Now it's a standardized statistical procedure that ensures that each version of the assessment or the examination, whether be it assessment of fundamental knowledge or assessment of clinical judgment, is of equal difficulty. Okay, so no 2 exams are different than each other. So the difficulty level of each exam or assessment that they carry is of equal difficulty. So once the answer sheets are scanned, what happens exactly is the main examiner, the chief examiner, he does a detailed statistical analysis of the questions that have been asked for that particular exam. And then after detailed statistical analysis, there is a possible elimination of the question that question may have underperformed or overperformed. Okay, so what happens is, because of this, the test is calculated. It ensures that equality of the test. Okay, so that is what the test equating procedure is. Okay, so all the assessment is of equal difficulty. Now, if you see the passing rate of this examination for last 5 years, it stands somewhere around 45 to 50%. Okay, so out of 100, 45 or 50 students, they pass in a particular attempt. Okay, so a very important thing to understand for these exams, whether it is assessment of fundamental knowledge or other 2 exams, that you are eligible to appear for this exam only 3 times. Okay, any exam for 3 times. If you fail 3rd time, your dentistry career is over. You cannot give these exams again. Okay, so you have to be very careful with your attempts, that you try to get passed in first attempt itself. So now what is the blueprint of this assessment of fundamental knowledge exam? So now there are different subjects which carry different weightage, different percentage in this exam. So the 60% questions will be from cardiology, including microbiology, biochemistry, restorative and prosthodontics and implants. 24% of the questions will be from pharmacology and therapeutics, local anesthesia, etc. 10% of the questions will be from orthodontics, pediatric dentistry, geriatric dentistry, special needs patient, including oral embryology. So these are tentative percentage, okay? So your questions will be somewhere close to this, okay? Maybe 9% or 10% for these questions. Then again, 10% for periodontics, including microbiology and immunology, 6% for endodontics, 17% for oral medicine, oral pathology, including histology and oral radiology, 7% from your infection control, ethics and jurisprudence subject, and last 10% from oral surgery, trauma, orofacial pain and everything. So if you see, this is overall structure. So if you see all the subjects that you have studied in your dentistry, in your BDS, they are all included in this. So you have to have very thorough knowledge for all these subjects, all right? Now, once you pass that, now about AFK examination. AFK examination happens twice in a year. It happens in February and it happens in August. Okay. And the fees for this examination is $800 Canadian dollars. Okay. And it happens in all dental colleges in Canada, in Ottawa, and in New Zealand and in Hong Kong. Okay. So you have to make note of that. Now, the second is your assessment of clinical judgment. Okay, so the assessment of clinical judgment is your second exam. Once you pass your assessment of fundamental knowledge, you'll be able to register yourself for either assessment of clinical knowledge judgment and assessment of clinical skills. So these two exams, you can pass one or the other before each other. Okay, so now what this assessment of clinical judgment? Now, assessment of clinical judgment, the format of this exam is consists of 2 sessions of 2.5 hours. In that, between those 2.5 hours, you'll get a break of half an hour for lunch or snacks. Each session, it'll have 120 to 150 questions. Okay, so one interesting thing about this exam is any question, it might have more than one correct answer. So you have to be very careful. It will be mentioned on the top that choose a single answer or choose a multiple answers. Okay, so there could be more than one correct answer for any particular question. Now again, scoring criteria is the same as your AFK. You have to get 75 or greater than that to pass. Okay, again, test equating procedure is there, and if you see the passing rate, it is much lesser than your AFK. It's somewhere around 35 to 40%. Okay, so only around, this is for last 5 years. So only 35 students out of 100, they pass this examination. Now, what are the components of this assessment of clinical judgment? Now, as the name suggests, you have to see, they judge your clinical judgment. Okay, so it is based on case-based diagnosis, treatment planning, and clinical decision-making and radiographic interpretation. Now, case-based diagnosis, treatment planning, and clinical decision-making questions, they evaluate your ability to formulate a particular diagnosis and to make a clinical decision for treatment of that diagnosis. Okay, so you'll be able to diagnose that patient or that whatever they have provided you with, and you have to give a suitable clinical treatment plan for that particular condition. Okay, then the radiographic interpretation questions, they evaluate your knowledge in oral radiology and ability to make interpretation and diagnosis using radiographs. Okay, so they'll be provided with you with cephalometric radiograph, IOPAs or your OPGs, and there will be a question. So I'll show you the sample question. Now in the sample question, they'll give you a picture of a patient. Okay, and it is written there, select one correct answer. So which of the following is most likely diagnosis for the entity shown in the photograph? So there will be a photograph. Oh, so in this case, there is a photograph, there might be cast, there might be models, there might be a radiograph. Okay, so accordingly, you have to select the correct answer. This is the second sample question in which you'll be provided with cephalometric values, okay, a cephalometric values or a cephalogram, okay. On that, you have to check the patient presents with. So whatever the correct answer is or are, you have to select those answers. So this is what your clinical diagnosis judgment is. Now again, clinical judgment blueprint is somewhat like this. You have 22% questions from pharmacotherapeutics, medically complex patient, medical emergencies. 28% questions will be from oral medicine, oral pathology and oral surgery. 15% questions from the periodontics, 10% from endodontics, 10% from ortho and pediatric dentistry, and 15% from cardiology and restorative dentistry. Now, AFK examination again happens twice in a month, or twice in a year, sorry. It happens in August and it happens in November, okay? So the registration fees for this examination is 1,350 Canadian dollars, okay? Again, this exam, you can attempt only 3 times. If you pass your AFK, if you fail this exam for 3 times, you won't be able to proceed further, okay? So you have to be very careful with that. And this exam mainly happens in prometric test centers in Canada and in New Zealand, Belgium, England, and Australia. So once you are done with your ACJ, comes your last exam, which is Assessment of Clinical Skills, or ACS, okay? So now ACS is very interesting exam which I found, okay? It evaluates your clinical skills, okay? There is no theoretical part in it, okay? So you have to be very thorough with your clinical skills. So you should have done practice and practice and practice, a lot of practice before you actually appear for this examination. Again, there are only 3 chances for you to clear this examination, all right? So what is the format of this exam? It is 2-day exam, okay? In which either you have to do rubber dam application on day 1 or day 2, depending upon the color of your pass, blue and red, okay? So in those 2 days, you have to perform 12 dental procedures on mannequins, okay? So I'll tell you which are those 12 dental procedures. And it doesn't have scoring system, it has grading system, okay? So the gradings are A+, A, D, and E, okay? So these 4 points grading system combination, what you have to get is, for each dental procedures, you will be given a grade, okay? Depending upon how well you have done. A+ is excellent, where there are no errors at all, okay? It is completely acceptable what you have done. A is acceptable, okay? Acceptable means that you have to do little bit of corrections or little bit of here and there, but the clinical outcome remains the same, okay? Still it is acceptable. There are no errors. Then D is errors. In those, the errors, you need to do certain changes in order so that the procedures is clinically acceptable, okay? And E is errors present, where the work or the procedures that you have done caused irreversible damage to the tooth or surrounding structure. So you have to find a completely different treatment for that particular tooth, okay? So you can have 12 A+, that is completely fantastic, or you can have 12A, again good. The combination is maximum you can have 4D and 1E. If you get any more D or any more E than that, you will consider as fail, okay? So you have to be very careful. Now, what are these 12 different procedures? You have to do metal ceramic crown preparation for a maxillary anterior tooth. You have to do metal ceramic crown preparation for a mandibular canine tooth, metal ceramic crown preparation for a premolar or a molar, class 3 composite resin preparation. You have to do only preparation, class 3 preparation for composite resin. Then class 2 amalgam restoration, they will give you pre-cut tooth in class 2. Okay, you have to do amalgam restoration in it. Then you have to do class 2 composite resin restoration again on a pre-cut tooth. You have to do endodontic access preparation. Now, most commonly, they ask you for endodontic access preparation for maxillary or mandibular molars, but last year they have asked endodontic access preparation for maxillary central incisor. Then you have to do class 4 composite resin restoration for pre-cut class 4 cavity, then class 2 amalgam preparation, then full metal crown preparation, provisional or temporization, and lastly your rubber dam application and infection control. So if you see the list of 12 dental procedures, they are mostly prosto and conservative dentistry based. Okay, so you have to be completely thorough with your procedures and how exactly you do these procedures. Now what is expected for this exam is coaching. Why I'm saying that? Because the way we work here in India, peeking inside patient's mouth, standing here, standing there, sitting here and sitting there, and not maintaining proper posture, not maintaining proper clock position. This is again very important. They observe your every move. They observe your every position. You have to use loops. You have to work in direct and indirect vision. So again, that is very important, all these things. So for that purpose, you have to undergo coaching for 4 months or 6 months and this exam is the most expensive exam that you can consider, because the examination fees is around 9,000 Canadian dollar, and the material, the equipments, instrument that you have to buy for this will be somewhere around 10,000 to 15,000 Canadian dollars. So you have to be very careful with this attempt, that you are thorough with your preparations and your skill, your motor skills. Okay. Again, this exam happens only once in a year in December. All right. Now, once you are done with these 3 exams, you are done with NDEB equivalency process. Okay. So once you are done with your NDEB equivalency process, you will get transferred to the NDEB certification process. Now, NDEB certification process consists of 2 examinations. This process, even the graduates of Canadian dental schools, they have to undergo this process. Okay. So this consists of written examination, in which there are again 2 sessions of 2.5 hours, and there will be 150 questions and you have to select a correct answer. Now, if you see the passing rate for this examination, it is significantly higher than your NDEB equivalency examination, around 85 to 90%. So once you're done with your all 3 exams, it is not difficult for you to pass this particular exam. Okay, because whatever you have learned so far, the questions will be asked from that syllabus or from that material only. Okay, from that resources only. Then last one is your objective structured clinical examination, which is called as a OSCE. OSCE, it is something like similar to our spots that we do in our second year, in third year for OPATH and for pharmacology. Okay, so it has stations, 25 to 30 stations, and each stations it has 2 questions. Okay, so those questions will be supported by some models, some cast, some radiographs, or you may have to write a prescription which is commonly prescribed by medications which are commonly prescribed by Canadian dentists. Okay, again the scoring criteria is same like AFK and ACJ, 75 or plus, and again if you see the passing rate, it is much higher, around 93 to 97%. Okay, so it is not that difficult. Once you're cleared with NDEB equivalency process, you can get sailed through this process very easily, certification process. Okay. Now this is what your journey looks like. Your AFK exam, your ACJ exam, your ACS exam, then your written. So these 3 exams is NDEB equivalency process for non-accredited dental graduates, and then your written and OSCE, which is NDEB certification process. So once you are done with that, finally you have your prize, that your certification, NDEB certification, and you are free to register yourself with any dental regulatory authority all over Canada, and you can work as a dentist. Okay. Now, non-accredited specialty programs. Now, this specialty program is particularly for those dentists who have done their masters, they have done their MDS. Okay, now this is very tough path to select, because I'll tell you the reasons for that. Now, what you have to go through is you have to give a dental specialty core knowledge examination, which is called as a DSCKE. Okay, So graduates of non-accredited dental specialty program, they'll apply for DSCKE examination. They'll take DSCKE examination. Again, DSCKE examination is consists of 150 questions. It is for duration of 3 hours. Okay. In that, again, the questions related to your specialty, questions related to oral medicine, radiology, periodontics, endodontics, they're asked. Okay. Once you clear that examination, you will get admitted into dental specialty assessment and training programs. Now, make note of this. These programs are offered by only 4 universities in Canada, and the seats and the competition is too scarce, okay, too fierce, okay. So you'll be having only 1 or 2 openings in 1 year, and maybe they won't open any specialization in those particular university. It completely upon them to open this program or not. Okay. So if you get admission into that program, you have to go through this program for 1 year. Then you'll appear for, National Dental Specialty Examination. Okay. And once you pass that, you'll get your licensure as a specialist, as orthodontist, prosthodontist, or whatsoever. So now, which are those 4 universities? First is your University of Toronto, which offers this program in all the branches. Then you have University of Manitoba, which gives this specialty program in pediatrics and orthodontics. Then you have University of British Columbia, which offers programs in endodontics, oral medicine and pathology, orthodontics, pediatric dentistry, periodontics, and prosthodontics. Lastly is your Dalhousie University in Halifax. It offers only in oral and maxillofacial surgery. So once you pass with DSCKE, you have to, your result will directly go to these university, and it's completely up to them if they want to let you in or not. So now, very strange thing, which is not mentioned anywhere, which is not written anywhere, but these universities, they want you to clear the NDEB equivalency process as well to apply for dental specialty program. Yes, this is not mentioned anywhere, but these universities, they expect you to do that. Okay. They won't just allow any international specialists to enter in a specialty program. Okay. Until and unless they are completely sure of it. Then you have the third part of our agenda is dental programs. Now in this, we'll see what are the different dental programs are there and what is a different path you can take if you don't have to go for NDEB equivalency process. Okay. And also the standing of your degree, what it stands in Canada. Now, dental programs, there are 3 dental programs: accredited dental programs, non-accredited dental programs, and specialty dental programs. Okay. So now accredited dental programs are those dental programs which are accredited by CDAC. Okay. Commission on Dental Accreditation of Canada. So these programs are the graduates or the dental universities that are there in Canada. Okay. Their programs is accredited program. Then all the dental programs from USA, they are again accredited dental program. Then Australian dentals, graduates of Australian Dental Council on and after 31st March 2010, it is again accredited dental program. Then graduates of New Zealand Dental Council or after December of 2011, they are again accredited. And Irish graduates, Dental Council graduates, on or after December 5th, 2012. And recently they have added graduates of King Abdulaziz University, which is in Saudi Arabia. Okay, so the graduates who have completed their BDS from that university after August 1, 2019, they'll be considered as an accredited dental program. So how accredited dental program is different than non-accredited dental program? So they have to just apply, they have to create your profile, their profile on NDEB portal. They have to register for NDEB certification process, which consists of written examination and OSCE. Once they pass that, they have to submit their proof of graduation from their university and they'll get their NDEB certification. So they don't have to go through NDEB equivalency process that non-accredited dental graduates have to go through. Okay, now non-accredited dental program. Now again, I've told you before that there are 2 pathways. One is NDEB equivalency process and the other is degree completion program. So I've told you in detail about NDEB equivalency process. Now I'll talk about NDEB completion program, degree completion program. Okay. Now this is something which I find interesting because with degree completion program, you have chance to actually get integrated into Canadian dental education system. Okay, you will be let out with a Canadian degree, dental degree, either DDS or DMD. Okay, and it worth a lot. So what is the process for this? First, you have to do same thing like your NDEB equivalency process. You have to do application and credential evaluation. After that, you have to give your AFK examination. That's the only thing you have to do. Once you give your AFK examination, you can apply for different dental degree completion program. Okay. Once you finish that program, you will be applying for NDEB certification process with written and OSCE examination. Okay. And once you're past that, you'll get your NDEB certification and licensure to practice dentistry in Canada, plus your DDS or DMD degree. Okay. So now there are all the universities, they provide degree completion program. I'll tell you about few of them. Okay. So you have to notice, you have to make sure the name that is correct. Okay. So you have to be aware of what is the name of that particular program for international dentists in particular university. So now firstly, I'll talk about McGill University, which is in Montreal. The program name is Degree Completion Program. Okay. So now what are requirements for this? You should be a Canadian citizen or a Canadian PR. Okay. You should have passed AFK examination. Okay. Only AFK examination you have to give, no ACJ and no ACS. And what is particular is their CASPER test. CASPER test is computer-based assessment of sampling and personality characteristics. Okay, so they feel that these non-cognitive skills, they are very important for them to have in a particular individual, so that that individual, that candidate can accepted into their degree completion program. Okay, so once you submit your application, total 70% of weightage is given to AFK exam. Then you have to submit your CV, which carries 20% of weightage, and your CASPER examination test, which carries 10% of weightage. After that, you'll be asked to come for multiple mini interviews at college. Okay. And if you clear those interviews, you'll be selected for the program. No, okay, about the details of this program, it is total 2.5 years, 2.5 years program, and the degree that you'll get is DMD degree. Okay, application deadline for this is September and program starts in December. So this is the website where you can get all the details for this. Next is internationally trained dentist program offered by University of Western Schulich School of Dentistry. Okay, which is in London, Ontario. This is the most easiest program. They don't have much of requirement or much of formalities, but again, competition is there. Again, you have to have a Canadian citizenship or a PR. You have to pass AFK exam. You need your transcripts and CV and IELTS exam. You have to give IELTS academic, not IELTS general, in which you have to get 6.5 band. Okay, that is the eligibility requirement. So once you meet all the requirements, you have to submit your application form, your application fees and everything, and supporting documents, and they'll analyze that, and accordingly they'll do the selection. It is 3 years program. You'll join into the second year of DDS of their program, and this program usually starts in December. Okay. Then your International Dentist Advanced Placement Program, which is offered by University of Toronto. Now, this is the most difficult university to get into because, as you know, University of Toronto is among world's top 10 universities. Okay, so they have very stringent rules and requirements, and after the requirement, their interview is very tough. Okay, I've seen people who have got 100 out of 100 in their AFK examination, and still they got rejection for this university only based on the interview. Okay, so for this, again, you have to have a Canadian citizenship or a PR, pass AFK exam. You have to submit your transcript, again IELTS. Then you have to do a CPR and first aid course by Canadian Red Cross, and your GPA for your BDS program should be more than 3. Okay. So once you fulfill all the requirements, you meet all the requirements, you have to submit your online application and you have to give your fees. They'll see the application, and if they ask you for interview, there are bright chance that you might get the seat. Okay. Every year they accept 26 students in this program. You, after selection, you'll get admission into special program for 6 months where they'll strictly observe your work, they'll observe your knowledge. Okay, once they are satisfied, you will be integrated into third year of DDS. Okay, and application deadline for this is June. Now, International Dentist Degree Program from University of Manitoba, which is in Winnipeg. Okay, this is the only program where you can apply without being a Canadian citizenship or a permanent resident. So this program is open for international students. So now there are two types of applications, track A and track B. Okay, track A are those students who have given only assessment of fundamental knowledge. Okay, and they have not given any other examination. Okay. Track B student, it consists of student who have given AFK examination and student who have given ACJ examination, assessment of clinical judgment, in last 3 years, and who have attempted clinical skills exam, which is the third exam, in the same year when they are applying for this program. Okay, they are called as track B students. Again, you have to get 6.5 band in IELTS, and you have to submit your autobiographical sketch, which is basically the purpose, the intention why you want to do this program. Okay, and your personal characteristics and features. Now again, selection process for track A students, they will get your documents, you have to submit your results, documents and everything, whatever they ask for, and you have to give a motor skill exam, okay, in which you have to perform procedures on typhodont, whatever they'll ask you for, and then they'll evaluate your work, they'll get your interviews and everything, and accordingly you'll get the admission. Students, they don't need to give any motor skill examinations because they have already done with or given their ACS, sorry. Okay. So once you're done with your track A and track B selection process, you will be getting admission into DMD degree in third year. Okay. Deadline particularly for track A student is around 15th of April and track B student somewhere around August 1st. All right. Apart from this, there are other programs offered by different universities. There is International Dental Degree Completion Program from University of British Columbia, DDS Advanced Placement Program. Now, University of British Columbia is currently not accepting any student in this program. They have closed it for time being as of now. Then International Dentist Degree Program by University of Saskatchewan. Then DDS Qualifying Program by Dalhousie University. So these are the programs, and where you can, the requirements remains one or the same that I have explained to you before. So if you see all these programs, they need candidate to have either Canadian citizenship or Canadian permanent residency. So that is again very important thing which is related to permanent residency. Okay. And for NDEB equivalency process, you don't have to have Canadian permanent residency or Canadian citizenship. Anyone who's in non-accredited dental program, they can apply for and they can go through that examinations. Now coming to our last agenda, last part of this presentation is permanent residency. Now permanent residency does play very important and major role if you want to get settled in Canada as a dentist. Okay, for the factors I'm going to explain you now. Okay, so first let me tell you a little bit in brief about permanent residency. Before that, we'll conduct a small poll. This is the last poll. You just have to answer that if you know about this process or no. Okay, so here you go. Okay, so 68% of my colleagues, my friends, they say that they don't know about this Canadian permanent residency and its benefits and process, and rest 32% they do know about this process. So good. I hope I can provide you some further details about this process. So we'll go to this permanent residency program. Okay, I'll share brief knowledge about this program. Just a second. Yeah. So it's an online system used to manage application for permanent residency from skilled worker. Now, skilled worker, they're classified, they are fall into category of federal skilled worker program, federal skilled trade program, Canadian experience classes. Now, we as a dentist or other profession, they fall under federal skilled worker program. This federal skilled trade program include those professions who don't have professional degree like butchers, chefs, or your electricians, and etc. Okay. Canadian experience class, it consists of individuals or candidates who have some kind of experience in Canada, like they have their education which have been done from Canada, or they have some kind of work experience after the education in Canada. Okay. So this is what Express Entry is. It is a point-based system where certain criteria are used to calculate comprehensive ranking system score, or which is commonly known as a CRS, which is given out of 1200. Okay. So now, which are those criteria which are involved? If the applicant is married or non-married, these criteria changes. Okay. So for non-married, unmarried person, you have to have these criteria ready: your marital status, age of applicant. Now, age of applicant, if you are up to age of 18 to 30, you will get 100 out of 100 points for this. Then level of education. Luckily, our dental education is considered equivalent to master's degree. It is considered as a professional degree. Okay. So you will get again highest point compared to the engineers or MBAs. It is considered as a bachelor degree, but our dental degree is considered as a professional degree. So you'll get again maximum marks for that. If you have any Canadian education or not, if what is your English or French language test score? For English, you have to give IELTS, general, not academic, or CELPIP. CELPIP is their Canadian own exam, Canada's own exam. And for French language, as you know, French is the second official language of Canada. You have to give TEF, okay, if you know French. Okay. So maximum you have to attend CLB 9. CLB 9 is Canadian Language Benchmark 9. Okay. So if you get that, you'll get maximum point for this criteria. Then if you have any Canadian work experience or not, foreign skilled worker work experience in your home country, how much year of skilled worker experience you have. If you have any valid job offer from Canadian employer, this is not possible in case of dentist because you need to have a license. Okay. You have to pass exam or degree completion program. So again, this won't be applicable for dentists. Provincial nomination. Provincial nomination is given by certain provinces if they find that we need these professionals, we have shortage of these professions, so they nominate those professions. Again, this is again not applicable for us and first blood relative of applicant, whether it's a brother or a sister. Now the points which I've highlighted in bold: if you are married, your spouse has to submit proof of these things. Okay. So those factors again will be considered while giving your CRS score out of 1200. So sometimes you will get benefit if you have a spouse, or if you make your spouse as a primary applicant and you as a secondary applicant, depending upon everyone's situation. Okay. So what is the process for this Express Entry? So now you'll get your online questionnaire on IRCC website. You have to answer a few questions, and if you're successful, they'll generate a one reference number. Okay. With that reference number, you have to create your profile. Now you have to be very careful when you create your profile that whatever you are going to enter in your profile, it should be accurate, exact. You should be able to present proofs for that. Okay. Because if you get invitation, your profile will get locked. You won't be able to make any changes in your profile. Okay. So if you won't be able to provide proofs for whatever you have submitted, then they will blacklist you and you won't be able to apply for this PR process for 5 years. Okay. So you have to be very careful. Otherwise you have to avoid or you have to reject this application. So when you submit your profile, you'll get your CRS score. Okay, CRS score is comprehensive ranking system based upon the criteria, the points that you have entered, details you have entered, you'll get your CRS score. And then if you get your invitation, then you have to submit all the proofs for those particular criteria that you have mentioned. Okay, so now this is what a round of invitation looks like. Okay, this is the last round which happened on 4th of March 2020. Okay, and the CRS score of lowest ranked candidate was 471. So current trend is somewhere around 470 to 475. So if you think that your CRS score, if you get your CRS score somewhere near that, you can expect an invitation to apply. Okay, it is a must that you should have an invitation to apply for permanent residency. Without invitation from Canadian government, you cannot apply for permanent residency. Okay. Then what are the benefits as a permanent resident and as a citizen? Okay. As permanent residents, you'll have access to social security and healthcare benefits. Now, healthcare is completely free of cost in Canada. Okay, for you and your family. Okay, so for citizens and for permanent residents is the same. You have right to work, live and study anywhere in Canada. You have protection under Canadian law and the right to apply for citizenship. Now, once you get your permanent residency, it is for 5 years. Okay, in that 5 years, you have to stay in Canada for 2 years in order to renew your permanent residency. That 2 years could be in breaks or continuously. Okay, so you can go, you can stay there for a month, you can come back, you can go again, you can stay for 2 months, 6 months or a year, but you have to stay for 2 years in order to renew your permanent residency. And if you stay there in those 5 years, if you stay for 3 years, you can apply directly for citizenship. Okay, you'll get your Canadian citizenship. So that are the benefits. What you cannot do as permanent resident is you cannot vote, you cannot run for election or office, you cannot join military, Canadian military, and you need to renew your PR. As I told you, for every 5 years, you have to be there in Canada for 2 years in order to renew your PR. Okay, so these are the benefits of being a permanent resident of Canada and citizens. Now, talking about benefits of permanent residency, particularly for dentists. Okay, so what are the benefits for us as a dentist for being a permanent resident? There are huge benefits. Okay, so first one is you can apply for degree completion program. I've told you earlier, all the degree completion program, they have first and foremost requirement that you should be a Canadian PR. Okay, you can apply for other specialty assessment and training program and other dental related programs as well. Okay, which are again registered and licensed. You'll get provincial funding programs for education. For example, OSAP. OSAP stands for Ontario State Student Assistant Program. This is for the PRs or residents of Ontario State. If you are a permanent resident and suppose you have to do one small course or any university program or any degree program, you will get provincial funding. So part of that provincial funding will be grants, which you don't have to return to the government, that you get to keep. If you show that your financial strength is not that good, maybe your $40,000 program will be completely funded by your Ontario state. Okay, like these other provinces also, they provide fundings for students for their education. That is a big thing. Okay, then financial institutes can provide financial assistance for NDEB equivalency process. This particular thing, they have the bank which is called as a CIBC bank in Canada. They have launched last year. What they did is, if you are a PR and if you are going to through NDEB equivalency process, they'll give you assistance of 100,000 or 1 lakh Canadian dollar for your exam, towards your exam. Okay, so if you are appearing for your AFK, they'll give you initial $25,000 that you can use for coaching, that you can use for training and all the things. Once you pass your FK, you'll be able, you can get up to $75,000 for rest of your 3 exams. Okay, but you have to give it back to the bank but the interest rate is very minimum. Apart from that, you'll also get benefits. You'll also get financial funding from micro lending institutes like Windmill Micro Lending. They'll give you funding up to 15,000 Canadian dollars to go through all these equivalency exams with very nominal minimum interest rate. And the last one is education fees. Now, suppose you have to go for dental hygienist program or dental assistant program or a denturist program for time being, then you have to complete your degree completion or equivalency process. The education fee for those programs for permanent residents and Canada and citizens, it is significantly less. Suppose there is one program, Masters in Health Management in McMaster University. The fees for that program for international students is 41,000 Canadian dollar. And for same program, fees for PR, permanent residents and Canadians is $20,000. So you can imagine the gap. Almost half of the fees you have to pay for any program. Okay, so if you are Canadian citizen or a permanent resident, your fees directly gets half. That's the huge benefit. So you can avail all these benefits if you are a permanent resident or a citizen of Canada. So this is a big bonus for you. All right. So now this is what exactly consists of your process of being a dentist, registered, regulated, licensed dentist in Canada. I've told you about the benefits also of being permanent resident, and I've told you different programs and NDEB equivalency process also. Okay. So now the announcement for next week is we are having live and exclusive question and answer and chat with Dr. Abbas Naqvi. He's director of CIDE Canada. CIDE stands for Canadian Integration by Dental Education. He runs an institute which gives coaching for all these exams, all those 3 exams, equivalency exam. So whatever questions, whatever doubts you have, you can interact directly with us on live question and answer, and I'll be providing you the flyer and the information for this program very soon in coming 1 or 2 days. Okay, so hopefully I'll see all of you there. And lastly is about migration. It is an expression of the human aspiration for dignity, safety, and better future. It is part of the social fabric, part of our very makeup as a human being, family. It's given by Ban Ki-moon, who was General Secretary of UN. And what Canadian Prime Minister Justin Trudeau has said, Canada has always been there to help people who need it. It is very true. Canada does whatever it can for their citizens, their permanent residents, that no other country in world will do. Okay, so it is very friendly, it is the country which is built by immigrants. Okay, so if you are sitting in a group of 100, you will see a person from each corner of the world. So that is the beauty of Canada. And lastly, sorry and thank you. These are 2 words said mostly by Canadians. Say these words more than anyone in the whole world. Okay, they'll say sorry for everything and they'll say thank you for everything. Okay, so that is what Canada is, and that is what your journey will look like if you choose to go for it. So if you have any questions or any doubts, for now, you can ask me. You can write in your chat box. Yeah, please. Krishna. Just a second. About the specialty program you didn't mention. Yes, specialty program I did mention about the DSCKE. Okay, so the examination that you have go through, that DSCKE examination, you have to apply for DSCKE examination. There is a specific, I've told you 4 different colleges which provide those special assessment and training programs. So if you pass that DSCKE examination, you can apply for your specialty, in particular that program, where it is available in that university or not, and you can get admission if you get selected. Okay, again, it is very tough to get into those programs, and they don't open every day. Means every year the college can choose to open this program or not. Then from Pratik, is it possible to pursue PhD after getting your PR? It is possible to pursue PhD even before getting your PR. Okay, after getting your PR, the only advantage you'll have with the fees, with some programs they prefer or they give preference to Canadian citizens or permanent residents. So that is again a benefit. Obviously, PhD is non-regulated because you don't do any patients. You are not involved in clinical work. So yes, of course. Then from Pruthi Palikar, what are the fees for dental programs? Okay, if you see fees for dental programs for each university, every year they change their fees. Okay, it is available from registrar's office. So for each and every program, you have to go to that particular program and you have to see fees for every year. Before the admission, they'll mention the fees for that particular program. So again, if you are PR, I told you before, there are financial institutes if you get admission into any dental program, the fees will be, you'll get loan for your fees, complete loan for your fees. So that is not the matter. If you get admission in the program, the money won't matter. Then from Krishna, considering the current racism situation, what is the situation of racism in Canada? I've told you, Canada is most immigrant friendly country. There is no xenophobia. Okay, it is built by immigrants. Okay, as I said, if you see 100 people, out of 100, around 90 people will be from different countries. So there are immigrants everywhere. Okay, so you don't have to worry about racism situation in Canada at all compared to United States or other European countries, particularly, I would say. And their gun policies are also not like US. It is stricter than even India. Okay. Courses like dental hygienist or health administration to avail PR? Good question again. So you have to, for each dental hygienist and health administration program, if you see website, if you see on government website, what will happen is they'll tell you which program you will be considered for work. So there are certain dental hygienist program. If you do those program, you'll get work permit. Okay, so if you get work permit, then automatically you will be getting points for education, dental education, because most of the dental hygienist program, they're of 2 years or 3 years, but you may get exemptions considering the fact that you have done your BDS. So each and every college, they have different scenarios. So you have to check with different colleges about that. And it is very good decision if you do a dental hygienist program or administration program. As I told you, dental hygienists, they can open their own dental clinics. Okay. And they can do their own, not all, but few dental treatments in their own clinics. All right. From Mekla, for application of PR, do we need a BDS graduation certificate? Yes, you do. As due to Corona, we did not have a graduation ceremony. So we haven't got our degree certificate yet. So in that case, you can have your provisional degree. Okay. And if not, sometimes they do accept the provisional degree if you get a letter directly from Office of Registrar or directly from Office of Exam Controller. So that thing is acceptable to submit as a proof, giving some reasons. So yes, this is possible. You have to submit a provisional graduation certificate. Okay, so if you have any other questions that you can think of, you can mail it to me, okay, anytime. And next time we'll be having live discussion with Mr. Dr. Abbas Naqvi, very talented person. He is in Canada since last 10 years and he runs very successful institute which offers coaching for National Board of USA as well as National Dental Board of Canada as well. So it will be helpful for you to hear it from him firsthand, what exactly it is, what things you have to expect when you face these examinations. Okay. So with this, I would like to conclude this webinar, and I thank all of you once again for attending with this such huge number and seeing your response and everything. Thank you so much. So I'll be seeing you next week. Okay. Thank you.